This is the Video Journal of Medicine, your televised report on developments within the profession that affect your practice today. In this issue, treating chronic diarrhea. This is Approach to the Patient with Chronic Diarrhea with Dr. Asher Kornbluth, Assistant Clinical Professor of Medicine, Mount Sinai School of Medicine in New York City.
I like to use the definition that I learned from Dr. Henry Janowitz, which is that for a given patient, diarrhea is defined as stool that is either too many or too loose. Objectively, you can define it as a fluid volume of greater than 250 cc's per day. I would call it chronic if it lasts for 4 weeks or longer. Not all of these patients are neurotic or depressed. They can be well-adjusted, emotionally stable, otherwise very happy people who just happen to have a very irritable bowel. Typically, there is some external stimulus or irritant that triggers the irritable bowel. Stress can be an important irritant factor in many of these patients. In many patients, food is an important trigger. It is therefore important for patients to keep track of what they are eating and how it relates to their symptoms. These patients may have inflammatory diarrhea from a bacterial or parasitic organism. Some organisms, such as strongyloides, may cause diarrhea up to 25 years after initial exposure. As we have seen, taking a careful history is essential in developing a working diagnosis when a patient presents with chronic diarrhea. In our next segment, we will take a look at the various diagnostic tests that should be employed to confirm the diagnosis.
In a moment, part 2 of Approach to the Patient with Chronic Diarrhea.
Do you get diarrhea too?
Yes, I get diarrhea. My immediate reaction is, oh my gosh, I'm in trouble. I use kaopectate because it works. Kaopectate stops my diarrhea. I rely on it.
Now back to Approach to the Patient with Chronic Diarrhea.
Once a differential diagnosis has been formulated, the next step is to order the appropriate diagnostic tests to confirm the diagnosis. The patient should not be subjected to unnecessary tests that may be invasive, expensive, and particularly uncomfortable. Poor stool collection techniques can have a negative impact on confirming your diagnosis. Many of these organisms are quite susceptible to environmental factors during sample transport. The organism may have been able to survive for 25 years in the human gut, but may only survive for a couple of minutes on a counter in the laboratory. It is important to keep in mind that many of these agents treat the symptom of diarrhea and not the actual underlying cause. Obtaining an accurate and thorough history from the patient can ensure a correct diagnosis and allow for effective and more specific treatments.
The Video Journal of Medicine is made possible through the support of Roche Laboratories, a member of the Roche Group.